Good afternoon. It's a pleasure to be here with you. This is Generosa Grana, Medical Director of MD Anderson Cancer Center at Cooper. Sunday is the annual Cancer Survivors Day, a real celebration of survivorship. We at MD Anderson Cooper have many planned activities to join in the celebration of survivorship with you. Today's webinar launches those activities. We have a team of caregivers that are very committed to taking care of our patients, and it's wonderful to see so many familiar names as your names come up on my screen. I have a couple of housekeeping rules. We are recording this session so others who could not log on today can participate. Please mute your microphone. I have tried to mute all, and we'll see if that works or not. Also, use the chat function to submit a question. We will do our best to gather them and reply to as many as we can. That's the balloon icon in your control panel. We have Beth Ratchkus here with me who will help me with the questions. And I look forward to a very interactive 20 to 30 minutes so we can address issues. So in the next 20 to 30 minutes, we are going to cover a series of topics that will include overview of cancer survivorship, give you a sense of the statistics, review the comprehensive need of cancer survivors and how those needs change depending on the stage of survivorship in which a patient finds themselves. We will focus on psychological as well as physical needs and how those needs also change during the journey. We're going to talk a little bit about the late and long-term effects of cancer treatment, which can affect survivors. And then we're going to finish by talking about how is cancer survivorship care provided, the different models that are available to take care of you long-term in the many years ahead of you. Now, to begin, who is a cancer survivor? It's basically any individual diagnosed with cancer. The term survivorship begins at the time of diagnosis and continues throughout the remainder of life. There are many types of cancer survivors, including those who are living with cancer, those that have metastatic disease and continue to live and function with their diagnosis, as well as those that are free of cancer. And you'll come to see as we go through this discussion that the needs and the issues are very different depending on where you are in that trajectory. Now, caregivers. Many organizations also include caregivers, families, friends in the definition of a cancer survivor because they face some of the similar problems that face survivors. They face fatigue, insomnia, anxiety, depression, loss of strength, and many of the physical symptoms that a survivor may face, they may also share in. And up to a small number of people talk about how their needs are being addressed. So as we, as a cancer program, focus on your needs, we also need to be thinking about what does your family need and how can we support you and give them resources. The family and the caregiver needs will change depending on where you are in the survivorship node. Now, to begin with statistics, this is a really exciting story. The number of cancer survivors is increasing very rapidly. Currently, and this is the most recent data available from 2019, there are 16.9 million cancer survivors in the United States. That's 5% of the US population has a cancer diagnosis. This number is projected to increase by almost 30% over the next 10 years. That will mean over 21 million cancer survivors will be living in the United States by the year 2029. So you have joined a very large and increasing rank of individuals with a loud voice, and that's an important thing because that's how the agenda gets fulfilled. Cancer survivors also are living longer than ever before. 67% have survived 5 or more years, 45% have survived 10 or more years, and 18% have survived over 20 years. So clearly an increasing and strong force in our country. Age distribution. Cancer is most common as we age, and the list of survivors also has that same recognition. 64% of survivors are currently aged 65 or older. So these individuals are facing the issues of retirement and the health issues that come with aging, in addition to the issues that come with cancer. 20% of survivors are aged 40 to 60 years of age. Clearly, these are individuals that face different issues. They're in mid-career. They also are often in the midst of raising a family and may have different financial and psychological needs that need to be addressed. And finally, survivors of childhood cancers face very different issues. They deal with fertility, they deal with employment, they deal with some of the long-term effects of therapy that may affect growth, that may affect endocrine function, etc. So each age group has its own issues that need to be addressed. And I'm not going to be able to cover all of these today, but again, I hope we get to cover several. The most common cancers to be represented. The most common cancers are reflective of the common cancers that we see in our population. 23% are female breast cancer patients. So I know many of you in this audience are mine, and you are well represented. 21% are prostate cancer patients. 9% are colorectal cancer. 8% gynecologic. 8% are melanoma. There are some common cancers that are missing on this list, and hopefully they will be added to this list as our treatments improve. For example, lung cancer is a common cancer, yet they're not highly represented on this list. So again, I'm hoping that this will change as our future treatments and screening improve. Again, why has the number of cancer survivors increased? It's increased because we're doing so much better when it comes to finding cancer early and to treating cancer. We've improved and expanded our screening practices. Breast cancer screening has come of age, colorectal cancer screening, skin screening, head and neck screening. This really has come a long way. And we also have advances in treatment of cancer with multimodality approaches. That means really all of the aspects of treatment, not just surgical management of cancer, but better chemotherapeutic drugs, the new targeted drugs that have been developed, the immunotherapy drugs that have changed the face of melanoma. This has really led to a great load of survivorship being added. Finally, survivorship has increased because we have an aging and diverse population. And as I've said, cancer is more common as we age. And by 2040, we anticipate that 73% of survivors will be 65 years of age or older. So an increasing population. Now, what are the stages of survivorship? And as you look at yourself, you'll have to determine where you fall into this question. Can those of you who can, please mute your mic? That will help keep some of the noise down. Now, the stages of survivorship are acute, meaning living with cancer. That's often thought about as the initial diagnosis and treatment of cancer. You're working on the diagnostic process, you're working on surgery, you may be getting chemotherapy. That's the acute stage of cancer survivorship. The extended stage is immediately following the end of active treatment. So surgery, radiation, and chemotherapy have finished, and now you are adjusting to your new normal. That's the extended stage. And then the permanent stage, or living beyond breast cancer, living beyond cancer, is post-treatment, long-term survivorship. It looks at the monitoring that is going on for recurrences. You're cancer-free, but potentially dealing with some of the long-term effects of the treatment that you've received. You're cancer-free, but potentially worrying about recurrence, second cancers, etc. And this is a very significant group of individuals. And finally on this list, I have patients with metastatic disease. They are cancer survivors. They are living much longer than ever before, but they have very specific needs because they often have the anxiety of living from scan to scan, being on one drug, planning for another drug. And we've recognized that in the breast cancer population by specifically adding a breast cancer navigator to our metastatic group to address those specific needs. Now, in 2006, the Institute of Medicine issued a report put together by a panel of experts that was titled From Cancer Patient to Cancer Survivor, Lost Transition. And it really highlighted the many problems survivors face once their treatment ends, and came with some recommendations. First, they noted that primary care providers and other providers are not always aware of the long-term side effects of cancer treatment. So there is work to be done in bringing the entire medical system to this level of knowledge. Secondly, primary care providers do not often receive guidance from oncologists. In our world of electronic medical records, sometimes that communication is not as good as it could be. Many survivors transition back to their primary care providers and seldom see their oncologist. So you can imagine that if that primary care provider is not well equipped and doesn't have all of the information with regards to that patient, it may be challenging for that patient. And finally, survivors themselves may not be as fully informed about survivorship and what they need to be focusing on as they could be. So this is another area that the panel highlighted could be improved. The recommendations that came from that panel focused on those listed on this slide. Increase awareness on the part of physicians, the medical community, nurse practitioners, and patients on the late effects of treatment and the need for survivorship care. The recommendation that we use evidence-based guidelines when deciding what treatment a patient may need in survivorship. Some physicians would order scans, CAT scans, bone scans, PET scans when they're not recommended. They're not the national guidelines. So how do we put out those national guidelines to help patients get appropriate care? They recommended improving access to care for survivors, improving communication across the spectrum of the team, improving professional education and training, increasing research so that we can learn more about some of the long-term side effects and focus on preventive strategies. And they recommended something that has gotten a lot of attention in the last 3-4 years called the Individualized Survivor Care Plan, which is something that patients are now receiving as they finish their treatment. You finish your chemotherapy, surgery, and radiation, and an individualized care plan is devised for you that reviews your treatment, reviews your pathology, reviews any potential long-term toxicity you can anticipate based on your treatment, and gives you a document that you carry in hand that is shared with your primary care provider. So let's talk about survivorship care and what that looks like. What are the differences between active treatment and survivorship care? And most of you are very familiar with active treatment. In active treatment, we focus on coming up with a treatment plan that's specific for you, whether that's surgery alone, surgery and radiation, chemotherapy, and hormone therapy. During the acute treatment, we manage the acute issues. We manage the issues related to surgery, side effects of radiation and chemotherapy. It involves intensive monitoring as needed, looking at scans, labs, and everything else that comes with it. And it also involves dealing with the psychological issues of a new diagnosis, coping with the adjustment to this new diagnosis. Very different from the psychological issues that one deals with late in survivorship. We're not so much focusing on the new diagnosis, but your new normal and coping with the changes that have resulted from that diagnosis. As we move on, survivorship is different from acute care, active care, in that it focuses on maintaining health and maintaining quality of life throughout the rest of life. It focuses on surveillance for recurrence, surveillance for new cancers, prevention and screening for new cancers or other illnesses that may be related to the treatment you've received. It focuses on monitoring and management of both the medical and the psychosocial late effects of treatment. And it involves very active coordination between the primary care provider, your oncology providers, and the entire team so that all of these issues can be addressed together. Is cancer care delivered during these phases of survivorship? In the treatment of active disease, in that acute phase, you're being managed by a team of people. You're being managed by a medical oncologist, surgeon, often a radiation oncologist, the nurse practitioners that work in those teams. You'll have a nutritionist, you may have a genetic counselor as part of that team. So there's a whole cadre of people that are working with you in your diagnosis and treatment plan. As we transition to survivorship, the team changes, and the time of transition to survivorship varies by disease site and by stage, and I'm going to show you that in a moment. For example, if a woman has non-invasive breast cancer, DCIS, we tend to transition her to survivorship in a year. She is very low risk. She's adequately managed by the survivorship team. On the other hand, if it's an invasive, high-grade cancer, high-risk cancer, or high-risk inflammatory cancer, those people will be transitioned at 5 years or some not at all. And the same differential happens for other diagnoses as well. And who provides survivorship care? In some settings, it's led by the oncologist still. Many more settings are moving to advanced practice providers providing oncology care. Nurse that provide survivorship care under the helm of an oncologist or surgeon who is supervising that team. Some centers have multidisciplinary that provide that, and other centers have a relationship between the primary care and the oncologist so that the patient goes back and forth between those team members. There really is no data as of yet as to which of these models is best and which has pros and cons. Clearly, the key is to make it individualized for the patient, and different patients need different things and want different things. So our key is to make sure that the survivorship care is appropriate to you. Now, here. Common question that comes up as we deal with survivors is what screening is needed as I enter into my survivorship node? Are tumor markers needed? Are scans needed? How about colonoscopies and endoscopies? How about mammograms and MRIs? And I would tell you that the specific screening guidelines by disease site, and they are affected by genetics and by family history. And I'll tell you how in a moment. For example, in the setting of breast cancer, no scans or tumor markers are recommended. No one has yet been able to show that doing PET scans, CAT scans, bone scans improves the diagnosis of early stage disease, and breast imaging is paramount. So we do mammograms, may do MRIs in some patients. Colon cancer is very different. CEA is followed, CT scans are followed closely, serial colonoscopies are recommended. And in prostate cancer, the tumor marker PSO is serially followed very closely. So depending on the disease and the stage of the disease, the screening tests that are recommended are different. Genetics also plays a significant role in deciding how an individual gets followed. For example, it helps us determine what tests to order and what screening cancers we need to focus on. If I have a woman who has a BRCA2 mutation, that is an individual who needs mammogram and MRI, but it's also an individual that I need to focus on pancreas screening, melanoma screening. And in the colon cancer syndromes, I need to focus on different cancers as well. So clearly, the definition of what a patient needs in their survivorship plan in terms of screening varies for the individual patient. There's a tremendous amount of research going on looking at new modalities to help follow survivors to screen for different cancers. You may have heard about circulating tumor cells in the peripheral blood. There are some studies that are being done looking at circulating tumor cells in bone marrow that may be markers of early recurrence. A lot of that research is ongoing. So what I tell you today is stay tuned. Your survivorship team will keep you informed as those things evolve to determine when they may be appropriate for you. Now, this is what I was alluding to about the stratification of survivors based on risk. This helps us to determine when is it okay to send the patient to survivorship clinic versus the primary oncology world. So low risk patients are those at low risk of complications of treatment and at low risk of relapse of their cancer. They may have gotten less intensive treatment. They have a higher probability of a cure. And these are patients that may be transitioned earlier and can often go to the nurse practitioner clinic or to the primary care provider. An example of that is non-invasive breast cancer. You cannot get into a better risk group than that, and those patients can transition very early. On the other hand, high-risk patients are high risk of recurrence because of the stage at which their cancer was diagnosed. And they also may be at high risk of late effects of treatment because they may have gotten aggressive chemotherapy that has longer term toxicity. So many of the leukemias and lymphomas fall in this group because of the aggressive nature of the cancer. Bone marrow transplant falls in this group, but some of the inflammatory breast cancers also fall into the same group. The important part about survivorship care is that it is a multidisciplinary effort, and a number of people are involved and are available to help you deal with the issues. If your issue is lymphedema, physical therapists are involved, sexual function, we have urologists, urogynecologists, gynecologists, insurance issues are addressed by social workers and financial counselors. If people have memory deficits from their chemotherapy, neuropsychology may need to be involved. And I often come back to the concept of genetics because many families who have genetic abnormalities need to focus on the impact for their families. So these patients have genetic counseling as part of their ongoing care. And finally, nurses and nurse navigators play an important role. For us, the needs of our metastatic breast cancer population alerted us that we needed a specific navigator to help them through their journey, and that will be a useful member of our team. Survivors themselves are an important member of the team, and it's really critical that the patient themselves understand their diagnosis and the treatment they receive. It's important that they are well prepared with understanding of the late and long-term effects of their treatment, and they learn what to do to maintain good health and to learn what to do about lowering the risks of other cancers. So for example, making sure they're on top of appointments and their recommended screening studies, making sure that they keep a good notebook so that as they're having both physical, emotional, financial concerns, they bring them up to the team so they can be addressed. Be aware of the symptoms that highlight the risk. So if someone's got a new symptom, a new headache, a new shortness of breath, bring that to the oncologist. And we also really want to make sure that they're aware of some of the research that's showing that healthy lifestyle may impact risk of recurrence, and how do we achieve that? So I think the role of the patient is very important for long, successful survivorship. Now, the psychosocial health of the patient is critically important, and it changes based on each stage of survivorship. Psychological distress, body image issues, relationship issues, financial issues are all important, but they will vary depending on where you are. For example, if you've just had a mastectomy, you may have more issues with regards to body image than you will 2 years from now when that has settled down, reconstruction has been completed, and you have a new normal. The issues around fear of recurrence, anxiety, and depression often are more acute at the beginning in the early phases of survivorship, and patients find their new strength as they get further into their survivorship mode. Relationships change and evolve over the course of survivorship, and financial issues can be very different. There may be much more of a financial hardship in the acute treatment as you're looking for transportation to appointments, you're missing work because of treatment, as opposed to later when the physical demands and financial demands are less. So clearly, our job is to focus on each of these issues at each of the stages of your survivorship, and you need to work with us to notify us as these become important. And highlight that healthy living and integrated health is an important part of your journey, and it too is important at each stage of your survivorship journey. It's always important to focus on nutrition, physical activity, stopping smoking if you're smoking, use of complementary strategies. Some people like to use acupuncture, some people like to use yoga, tai chi. Some people need more structured psychological support, behavioral health strategies. This is important. None of these things are right for everybody, but they should be available to everybody who needs them. So depending on where you are in the survivorship mode, these are the things that need to be addressed. If you talk to your oncologist, they will have specific reading material that they may recommend. I have some books that I like. Others, we have Dr. Pallav Mehta, who's an integrative medicine physician, who's one of the oncologists in our group, who's written about integrative medicine. So there are tremendous resources out there that look at how to put all of the buckets that are on this slide together to optimize your survivorship plan. So now let's look, we have a little bit of time left, but let's look at some of the side effects of treatment that are experienced by survivors. And when we talk about effects of treatment, we need to talk about long-term effects. They often begin during treatment, but they continue for months or years after treatment has ended. And then there are late effects. The late effects are those effects that happen many years later, can progress over time, that can be sometimes subtle. They may not be as obvious as you suspect, and they can vary depending on age of the patient. So for example, some of the late effects may be cardiovascular, some of the late effects may be pulmonary, they may be new cancers that are due to the effects of the initial treatment. This is a series by the Lance Armstrong Foundation by Livestrong that polled over 1,000 individuals, and these were some of the challenges that they identified in cancer survivors. 54% are dealing with chronic pain, 53% feel practical and emotional consequences of cancer are more difficult than the medical issues. So the living, the everyday living, employment, insurance, financial. 70% experience depression. We don't know to what extent. 58% were dealing with loss of sexual desire or sexual function. 34% felt trapped in a job to maintain insurance coverage. 25% were in debt due to treatment, and 33% were dealing with infertility. And as we have more early young cancer survivors, that is going to be an increasing problem for many. So there are many issues that survivors are facing. In the future, we need to identify new ways to address these issues so that we can help survivors get through this. We need to improve our communication so that we communicate better with you and with other providers that are part of your team. And we need to empower cancer survivors with knowledge of their disease, knowledge of their risks of recurrence, information about lifestyle modification that can be both to help quality of life, but decrease risk of cancer recurrence or decrease risk of other cancers. In one final thought, I would say that our survivor population is booming, and I think it will continue to do so with new populations, lung cancer coming on board as a group of survivors and others as our treatments improve. Survivorship care is evolving. It requires a team approach, and it is critical that it be available to you. And it really, survivorship care is one of the more interesting, but can be some of the more complex and challenging phases of cancer treatment, because it is such a long-term process and there are so many things that come with that survivorship mode. There are many resources available to you, not only those that we at the Cancer Center have that are available, but also outside community resources, the American Cancer Society, Livestrong, Living Beyond Breast Cancer, Komen, many, many others that some are on this list. And I will stop there and thank you for spending time with us talking about a topic that I think is very near and dear to my heart, but hopefully is important to you as well. And now we're going to take some questions from you. Let's see, I have them here in front of me. What do I need to know about my future problems for my chemo and radiation treatment for breast cancer? It depends very much on the extent of radiation that you received. So for example, if lumpectomy and simple lumpectomy and sentinel nodes, the radiation is a little bit more limited. If the whole chest and lymph nodes were radiated, it's a little bit more. So there is a risk that may involve the treatment, and that needs to be covered. Chemotherapy's risks vary. They may include neuropathy depending on the drugs. They may have some cardiac risk, whether adriamycin or Herceptin were used. So that's a question that you need to bring up with your oncologist so that you have a better understanding, and there's some great tools. First, you begin by saying, hey, what was my treatment? What chemotherapy did I get? Are you on hormone therapy? Because if you're on hormone therapy, we also need to worry about your bone density. So that will help set the stage for what kind of screening you need. Okay, our second question, is there anything special cancer survivors need to know about COVID? Well, we are living in a pandemic. So yes, there are some interesting things. First of all, the very little concrete data. What we know about COVID comes from some 15 or 16 patients that were reported out of China. There's starting to be some data evolving out of Italy and some data coming out of the United States. Clearly, patients that are immunosuppressed have a higher risk of getting sick from COVID. And patients with lung cancer, probably because of the have a higher risk, but it is by no means a death sentence. We've had survivors very well with a COVID diagnosis. Now, who's immunosuppressed? So some individuals are immunosuppressed if they're on chemotherapy, if they've had a bone marrow transplant or a solid organ transplant. If you've had radiation, that is not immunosuppressive. If you're on a hormonal agent, that's not immunosuppressive. If you just had surgery, right around surgery, you're somewhat suppressed, but after surgery, you're not markedly so. So your level of risk varies, and we've tried to do a lot to inform patients to make them feel comfortable that they may be, the ones that are at higher risk should be taking things, taking precautions, while the people that are not at increased risk should be living their life like the rest of us. How can I prevent being diagnosed with metastatic disease after my 5-year anniversary? The risk of late development of metastatic disease depends on the features of your cancer. So if you had a triple negative breast cancer, it is uncommon to get late development of metastatic disease. On the other hand, if you had a hormone positive cancer, that risk varies depending on how big was your cancer, was it node positive, what were some of the other features. So your team can actually give you a better handle on that. I tell my patients your risk is never zero, but every year that you get past that 5-year anniversary is a really wonderful time and decreases that risk. Next question, top lifestyle modifications that you recommend to your patients. So first I'm going to tell you that you should do what I tell you and not what I do, because I'm not exactly thin and I'm not exactly very physically active. I am a big believer in what Dr. Pallav Mehta practices, and I love a book that was written by Dr. Lorenzo Cohen. He is a psychologist at MD Anderson in Houston. He heads the integrative medicine program in Houston. His book is, I believe, called Anti-Cancer Living, but if you Google Lorenzo Cohen, C-O-H-E-N, you'll find his book. And he really highlights, and Dr. Mehta in his book highlights some of the same things, which is the concept that you need physical fitness. Exercise is really important. Nutrition is important. And by nutrition, it's healthy eating, controlling calories, lots of fruits and vegetables. I'm not necessarily convinced that organic or non-organic. but exercise and good nutrition, but also things that will control your mind, sort of relaxation, meditation, yoga, things that will bring calm to your mind. Alcohol with moderation. More than one alcoholic drinks per day have been shown to increase risk of breast cancer early stage and to increase risk of progression. So just really focusing on lifestyle as a whole, getting enough sleep. That's a big one. I don't get a lot of sleep. So getting enough sleep is important. And all of these other things that I think are critical. So I urge you to find a couple of those books because they teach you lifelong lessons. All right, how do we request getting our personalized survivorship plan? It does not appear to be normal. I'll tell you that it's relatively new. It's been something that's evolved over the last 3 to 4 years. It is done for patients now that are finishing their active treatment. So we're not going back and doing this for patients that are 5-year survivors or 10-year survivors. We're actually doing this because it's so time consuming on the team for patients that are finishing their active treatment. It involves a one-on-one visit with a nurse practitioner for about an hour, and you review your treatment and you come up with a document. But more and more centers are devising ways to do this, and there are also ways to do your own. So if you look at some of the sites that are out there, there are specific guidelines as to how to compile a care plan. And it begins with having your pathology report, having your radiation treatment, your surgical treatment, and your chemotherapy treatment. But again, bring it up with a team. Now, another question. Okay, was one of the that was in one of the. Let's see. Oh, goodness. Lately, there have been a number of celebrities whose breast cancer has returned after 15 to 20 years. Is this concerning? It is not common, but it can happen. And if you notice, these celebrities were not heavy. They were thin and active. And so it really harkens back to the concept that a lot of what the future risk is depends on the futures of your cancer at the beginning. We know nothing about those celebrities in terms of what treatment they received, whether they received treatment or not. Again, this is not the norm of what. Now, last question that I'm going to take. I have metastatic breast cancer in my spine and bones, and am now on my 3rd set of hormonal therapy, Piqray. Several side effects. So let's talk about Piqray. Piqray, the most important thing about survivorship is the advances that have happened in the care of cancer over the last 10 to 15 years. 5 years ago, for metastatic cancer, we had few options. We had our hormones and we had chemotherapy. For the last 5 to 7 years, we've seen 4, 5 new classes of drugs, the CDK4/6 inhibitors, Verzenio, Ibrance, and Kisqali. We've seen Piqray, which is the newest chemo block, and Afinitor. These are amazing drugs that have amazing activity. They unfortunately come with a price tag that can be daunting and a side effect profile that can sometimes be daunting as well. But I think they highlight the excitement that we all feel about the new things in cancer today and how this is likely to move from metastatic disease to early stage disease. Of Piqray, I'll stop here because of Piqray, what concerns me, diabetes and sugar management more than anything else. So work with Dr. Pallav, as I know you will, because he's very good at this. So thank you. This was a lot of fun. We have some others planned later this month, and we're going to put some of this, we've recorded it so that we can send it to everyone who registered, who could not be present or who couldn't figure out the call-in system to call in. But I thank you very much for being a part of this program and for allowing us to be a part of your survivorship team. Cancer is a new world today, much more so than ever, and it's a positive journey, not a fearful journey. So thank you for being with us. Okay.